Burns can be caused by different things. We can have direct burns from a flame, from something that's hot, chemical burns, sunburn, electrical burns, or even radiation and other substances can cause problems within the body. Now what we're going to look at start with the different types of burn. There's three main levels of burn. Superficial burn, which is just initial redness on the skin. Partial thickness, which is where you get blistering. And full thickness is where it goes right the way through. Now with full thickness, sometimes you can get nerve damage as well. So with that type of burn, you may find that that is not painful or not as painful as some of the lesser burns. Old words you might have heard of before with these were first degree, second degree and third degree, but we don't tend to use those anymore. As far as the surface area of the body is concerned, we need to look at, if we're giving an assessment to a paramedic about how much surface area has been affected, we need to give them some idea. So generally speaking, 1% of your body is your hand. One arm is 9%. Your head is 9%. Your front part of your body is 18. Your back is 18, and each leg's about 18. Now, these are just general guides. So if you need to assess what sort of level a burn is, then let's give you a rough idea. So 1% would be the hand. When we're looking at the different burns as far as getting emergency medical care, if you're concerned, always take somebody to doctors or hospital or call the emergency services. But the general sort of guidance would be, if you've got a superficial burn and that burn is more than 5% of the body, vaguely, maybe half an arm, something like that, then you should consult the emergency medical services. If it's a partial thickness burn, it's got to be looking at around about 1% or less than 1%, which is not that big, just a small area of your hand. When you start getting to a full thickness burn, then we're looking at any type of burn that goes right the way through, should be checked out by emergency medical services or a doctor, because you've broken the layer of skin. There's a high probability that infection could get into the skin and something that needs to be treated straight away. Now we're going to look at scenarios shortly on the actual treatment of burns, but one of the things we refer to and you'll see out and about in kitchens and in the workplace are burns kits. Now here we've got some different types of burn kits, depending on how they are. Some of them are in plastic cases, some of them are in a softer case. So if we just sort of roughly look at what's actually in them. Now burns kits will usually be kept somewhere where they're easily accessible. The sorts of dressings we're dealing with are these types. They come in a foil wrapper, they're made by different companies, but the actual dressing itself is a wet dressing. And we'll show you how these work in the demonstration shortly, but with the dressings themselves, have a look through, make sure that the package is not damaged. Because it's a wet dressing, if it starts drying out, then it won't be any use. On the unit as well, you also see date of expiry, so make sure that the date is still intact. And these are the sorts of checks you can do as a first aider, regularly checking the equipment. You notice there's a little notch in the top here. This is just to help you tear it. You won't easily be able to tear the foil at this end, but this end you can, because it's got the notch in. You literally just tear that open and you can take the dressing out. Other items in the box will be smaller dressings. Some of them have full-size dressings as well to put over your face. Here we've got just some sachets of the gel for the cooling. And in an ideal world, we always wash a burn down under a tap for about 10 minutes. But if not, these, because they're wet dressings, you can use them nice and easily. In here, you'd also have some bandages. These are just to hold these dressings in place or hold cling film in place. We'll talk about that shortly. Some shears to actually cut away clothing. Now, it's important to remove any jewellery from the patient because of swelling, but also we need to remove clothing. Now, we would not want to pull clothing off of a burn. If the clothing is in place, leave it there. Only remove it if it's safe to do so and it doesn't affect the person in any way. Maybe if they've got a shirt on, it comes down to the wrist, you might want to cut around the top here and then just up the back, just so that the material is still there, but there's no risk of when you pull the arm out, it's actually just pulling on the clothes, the trousers or the shirt sleeve, and then causing a little bit more pain. Other items you may have in there, we've got a pair of gloves. It's vital you do wear gloves. We're dealing with anything to do with burns because we want to make sure that the burn is kept as clean as possible. The skin is the body's natural defence. Your skin is very, very tough, but when it's broken, that's an easy way of infection and problems to enter the body. Other stuff in here is just a solution. We've got a burn cooling substance. This is just to actually pop onto the burn, and again, if you're working in a remote place. Other things you could use to burn, if you haven't got water there, would be maybe an emergency eye wash station. Just to show you sort of differences, other burns kits may have other items in them. This one here has got a burn bag, and the idea here is to actually put your hand. So if there is a burn, you can just open it up, take the bag out. We just open it up, and what we're trying to do then is, if there is a burn to the hand, is popping the hand into the bag, securing it around with the straps at this end. That does just keep it nice and safe. The important thing with anything to do with burns to the hand, obviously remove rings and things like that, but we've got to be careful that we're not going to push the fingers together. If you push the fingers together and there's burning there, it can cause them to stick together. So keep the hand apart when it's in the bag. You may want to just pop some of the burn dressing in between. So these burn bags are in some first aid burns kits, others don't have them. This here is a larger type of burns dressing. It's designed to go over a whole of the face. Now, if you need to, you can always use this as a small one as well. It doesn't really matter, but usually try and pick the one that's the right size. Now, if you haven't got burn film, don't worry, because you can just go and use normal cling film. Again, we'll show you how this works later on. Cling film or burn film works by just applying a layer of plastic over the burn, keeps the oxygen out. It will make it much easier, it's less sensitive, so therefore it reduces pain for the person who's got the injury.